Why is VFSS used for swallowing assessments after stroke? Imagine trying to watch a movie in real time to understand exactly what's happening on the screen. That's what a Videofluoroscopic Swallowing Study, or VFSS, does for doctors when they want to see how someone is swallowing after a stroke. When a person has a stroke, parts of their brain that control swallowing can be damaged, making it hard to swallow safely. This can lead to food or liquids going into the airway, which is dangerous and can cause pneumonia or other complications. VFSS is considered the best way to get a clear picture of how swallowing is working because it shows the entire process in real time. During the test, the patient swallows different types of food and liquids mixed with a special contrast called barium, which shows up on X-ray images. This allows the healthcare team to see exactly how the food moves through the mouth, throat, and into the esophagus. It helps identify which parts of swallowing are affected, whether it's the initial movement of food in the mouth or the reflex that protects the airway when swallowing. One of the main reasons VFSS is used after a stroke is to check if food or liquids are entering the airway, a problem called aspiration. Sometimes aspiration happens silently, meaning the person doesn't cough or show obvious signs, making it hard to detect without imaging. The VFSS can catch these silent aspirations, helping prevent serious issues like lung infections. Another important reason is that the test helps determine how severe the swallowing problem is and what specific muscles or phases are affected. For example, it can reveal if the tongue isn't moving food properly or if the muscles that close the airway aren't functioning well. This detailed information guides doctors and speech therapists to develop personalized treatment plans. The results from VFSS also help decide what kind of diet is safest for the patient. If certain foods or liquids are too risky, the team can recommend modifications or alternative feeding methods, like a feeding tube, to keep the patient nourished and safe. Plus, because swallowing can improve over time, repeating VFSS allows healthcare providers to monitor progress and adjust therapy as needed. Overall, VFSS provides a safe, detailed, and objective way to understand swallowing problems after a stroke. It helps prevent complications, guides treatment, and supports recovery. Always remember, each person is different, and healthcare professionals will tailor assessments and treatments to fit individual needs. If you or a loved one has had a stroke, consulting with medical experts about swallowing assessments like VFSS is essential for safe and effective care.